Okay, so welcome to our webinar. I think, yeah, the recording has been started. Hello, good evening from Austria, good morning or good afternoon, wherever you live. I'm Dr. Sabine Marinschek. I'm a clinical psychologist and medical scientist, and I'm working for NoTube since over a decade. And I'm happy to answer your questions today about our telemedical treatment options. Um, Thank you to my colleagues who co-host this event today, Cassie, Eva, Sonia, Marion, and Melanie. They will also help and to answer your questions. Please, if you have any questions, use the Q&A button on the right side on the on your screen. And I'm very happy to answer all your questions within the next hour. So this is about our telemedical programs at NoTube. Basically, almost all of our treatments options include at least a partial telemedical setup. So even for those patients who come to us for a 2 weeks intensive course, the Eating School, they will be followed, the aftercare will be done online. And besides that, we also have telemedical treatment options, which are only telemedical, so only online treatment, either for tube weaning and also for treatment of other feeding and eating disorders. Yeah, so maybe we start with answering your questions. We also got some questions via email. For example, one of them was how tube weaning works online. Tube weaning online we do with our net coaching program, which has been funded already in 2009, so a very long time before virtual therapy and online treatment got popular, which was basically during the last 1.5 years since COVID got an issue. But we do this since 2009 to help children get rid of feeding tubes on tube feeding via our telemedically approach, the net coaching. And this basically works with an intensive conversation with our team. So every patient who joins the net coaching program with us is followed by a team of 3 medical professionals, 1 pediatrician, 1 clinical psychologist, and 1 feeding therapist. And we are in contact with the family on a daily basis, including holidays and weekends. So every day, and this is all done via a secure ticket platform where we have basically all the data of the child at all times. And there we communicate asynchronous because that's way easier due to time difference and so on. And you fill in intake protocols for your child, you get feeding plans for your child. We do a lot of video analysis in order to tell you which is the best position to feed your child, which food is good, is a good fit for your child, which feeding tools are good. And yeah, and so we work with you and your child on getting rid of the tube or of the tube feeding. And our program lasts until the child is completely weaned off the feeding tube and 1 month more in order to stabilize the situation. The good thing about the net coaching is that there is no limited time frame. So sometimes with some inpatient or outpatient treatment, you have like a limited time to join. With net coaching, you can take as much time as your child needs. This is a very important factor. And besides that, of course, there are no travel costs involved. Your child can stay home in your in his or her familiar environment. There is no risk of nosocomial infections, which a medically fragile child, which most of our patients are, can easily catch during an inpatient hospital stay. Yeah. Okay, next question is, what is success rate with NoTube online program? The success rate is 90.5%, which means that over 90% of all participating patients get completely weaned off their feeding tube. So a success means that the child is able to sustain themselves completely orally, so no additional tube feeds are required. So in most cases we succeed with that. In some cases, the children still need partial tube feeds after the treatment. This is especially the case in kids, for example, with metabolic diseases who require a certain feeding regime also during the night and so on. But yeah, so the success rate is over 90% and is also published in a lot of our journals. If you're interested in the literature, please let us know, and my colleagues will send you the link to our literature section. Next question is if net coaching is just as effective as the eating school. Answer is generally yes. In numbers, it's even more effective. So if we compare the numbers between net coaching and the eating school, they are both fortunately very high, and there is no significant difference, although the success rate for net coaching is even a bit higher. This may be related to the fact that it's not time limited. So the net coaching is, you can participate as long as you want, and if, for example, if your child falls ill, then we can just pause the weaning. If you come for an eating school for 2 weeks from far away and then your child falls ill, of course, it's not so easy to pause because, you have had this journey, and of course, this is way more difficult than to pause, to do a break during the net coaching. Besides that, the children who participate in the net coaching are mostly younger. So we have a lot of babies in the net coaching. This may also contribute to the fact that it has such a high success rate. But also the eating school is basically a combined program of on-site and online program, because there are 2 weeks of eating school and afterwards you're followed up by telemedical treatment for as long as your child needs to get rid of the tube. Someone is asking, is there someone who can fit his tube if he pulls this out in the night? You mean if I come to the eating school to Graz? And the next question is, hi there, is your 95.5 success rate based on one round of visits, online program, or multiple visits? It's based on one participation in the net coaching. As said, the net coaching is not time limited. So we treat the child as long as it needs to get rid of the tube with a maximum of 6 months. If it hasn't happened within this 6 months, we reevaluate the situation afterwards. But if you sign up for the net coaching once, the program includes the whole tube winning process. And there you have daily contacts to our therapists. As said, every child is followed up by a team of 3 on 7 days per week. So, yeah. So one cannot really talk about visits because it's a program where you're in daily contact with the experts, actually. Michelle is asking, hi, I'm a feeding therapist working in an outpatient, wondering how you are able to monitor the child medically using net coaching. Thank you. Yes, this is a very important question. First of all, every child who wants to do our net coaching has to go through an assessment process. This assessment process is standardized and includes video analysis of the child. So we request videos of the child trying to eat, trying to drink, and then in the situation not related to eating or drinking. Then we ask for medical reports for at least the current ones, and also therapeutic reports. Some children already receive like speech and language pathology treatment or anything else. We also require reports from them. And we also have a standardized questionnaire. And only if two of our professionals, one of them is always a pediatrician, who read through this assessment independently, think that this child is suitable for our net coaching program for tube weaning, then the family gets the suitability information that they can start the net coaching. For the net coaching, it is important to have a doctor on site who is willing to see the kid if something happens, the child falls ill during the weaning or anything. But they have to know at least that the child is undergoing a weaning, an online tube weaning. Besides that, we're in contact with the family on a daily basis. So every child is monitored by a pediatrician every day, so also on the weekends and holidays. And we have an intake protocol where we can see every day the current weight of the child, the current intake, and we can adjust the feeding plan every day. So we make sure that there is no risk for dehydration or electrolyte imbalances, because we always can quickly adjust to the child's current situation. And of course, if we reduce tube feeds, we do this under a certain regime, which does not put a single child in any danger for any problems with dehydration or electrolyte imbalance or anything like that. Is the daily contact also after you have been to the eating school? Yes, exactly. So eating school is 2 weeks on site. It's 1 week telemedical preparation, in fact, and 2 weeks on site, and then telemedical aftercare until the child is fully tube weaned. Or in case the child doesn't have a feeding tube, because of course, there are also many kids who have other feeding disorders, then it's another 2 months. Next question is, my son is 1 and has food aversion. There is no medical reason for him not to eat. He gags when trying to eat. Would the eating school be suitable for him? Yes. As said, the medical assessment is also necessary for the eating school, so we will also do the very thorough analysis of all your child's data. So, of course, I can't tell you from only this information, but from what you write, food refusal without physical underlying medical disease. Of course, we have a lot of children with these problems who come to our eating schools, so we work closely with them and are very used to this kind of problem. How long is the online program? Yes, that depends. If it is a tube weaning, the net coaching, then it lasts until 35 days after the very last tube feed. So at least until the child is able to eat enough orally, and then for more than 1 more month afterwards to see how the child stabilizes, no matter how long it takes for the child to get there. Then we have other telemedical programs. For example, we have the Learn to Eat program, which is for children with other feeding problems, like having problems to change the texture of the food, or having problems getting rid of breastfeeding or bottle feeding, or children who show non-organic failure to thrive. And this is a program which lasts 3 months, and this also includes phone calls, video phone calls. And this can, after 3 months, you can of course prolong it on a monthly basis. Marie asks, our son 2 years has many intolerances. Is net coaching a better match than eating school? Because I read the eating school involves a lot of cake eating. First of all, we have a lot of kids with certain food intolerances or allergies. And also in our eating schools. In our last eating school, we had a kid who was basically allergic to many things, like at least 10 different things. He couldn't eat, from cow's milk to egg to nuts to anything. So we take good care of that, and this is generally no problem to join the eating school, and we will find substitutes for your child. Of course, the eating school involves a lot of playing, touching, tasting different kinds of food. So it is not necessary per se to not join the eating school because of intolerances or allergies. We take care of that. But of course, the net coaching would also be a good option for you, because then your child can stay home in its familiar environment, and you can see what he likes or dislikes, and you're able to cook with yourself and so on. So this very much depends. But generally, we are able in our eating school to take care of all intolerances and allergies. Another question is about sleep feeding. Yeah, this is also a problem we see quite regularly, and we treat quite often at the moment. I think it got more within the last decade. So we call it dream feeding. So children who are only fed during this sleep, and we have seen children with dream feeding at the age of 4 or 5. So they've been dream fed for a very, very long time already. So this is also a very common diagnosis or very common problem in the children we see and treat in all our different programs. Stefan, during net coaching eating school, do you face issues like weight loss at babies? Yeah, weight loss is an important topic. Of course, tube weaning costs some weight, because one cannot expect a child to get hungry, so to reduce the tube feeds and to catch up within 1 day. So a certain amount of weight loss is normal, but this is closely monitored by our pediatricians, and we take care that it doesn't get too much, and we also so mostly it's like the children lose, then they get to a plateau, and then they start gaining again on full oral feeds. So this is the goal of the tube weaning. But of course, some weight loss is mostly inevitable. Do you still have space for October eating school? I think my colleague Eva will answer this. We're completely booked out for the next one in September, but I guess for October there may be still some space. Stine, our daughter is 6 years old. She's tube fed. Is the treatment suitable for older children? Of course. So the oldest patient we weaned off the feeding tube was 21 years old. So it's also suitable for older children. But sometimes for these kids, it's better to come to the eating school, because they profit a lot from the peers and the therapies there. But we also had a lot of kids age 6, 7, 8 in the net coaching, and it also worked well. So this is no problem at all. What program is generally the quickest in getting rid of the tube? Um, well, that depends. I would say the net coaching, but because of the fact that there is no waiting list for the net coaching. So if you sign up for the net coaching and you do the assessment and you get the results from the assessment within 5 working days, you can start right away. There is no waiting list with us. And so you can start basically the day you have received your assessment results. With the eating school, of course, there is a waiting list, or at least there are some dates for the whole year, and you can sign up for one or the other. But as said, for example, our next one in September is already booked out. So there is always like, depends, 2 or 3 months. You have to wait to come to Austria. So that's why the net coaching may be the quicker option, or at least the one you can start the earliest. Besides that, maybe it's also interesting that if you decide to sign up for the net coaching and you start the net coaching, and after some time you get under the impression, okay, I think my child might profit from some hands-on approach, then you can always sign up for the eating school for a reduced price. So you can combine the 2 treatment options if you don't think that the net coaching is like enough, or you think you want some additional support. Next question: if a child is tube fed and feeds through the night, how are they weaned from the night feeds? Yeah, we have a lot of kids who are on night tube feeds. That's generally no problem. It's that doesn't have an influence on the outcome. If the child is both fed, continuously fed through the night, fed through the day, it doesn't have an influence on the outcome or on the program itself. Do you have any experience with children having sugar level complications while on the in-person or net coaching program? Fortunately, we never had this problem with kids who don't have an underlying disease causing low blood sugars, because we take care of that so that that doesn't happen. After years of experience, we know how it is, how we can reduce the tube feeds in order to keep the child safe and healthy and in good spirits. And of course, we always tell the parents what they can do if a certain thing happens, or especially if the child gets low in energy or anything like that. So they always have an emergency plan on, and we give them. Sometimes we treat children who have underlying problems with low glucose levels or blood sugar issues. And these children are closely monitored by the parents, or even sometimes by a clinic next, so on site. But mostly it's sufficient if the parent check the levels regularly. But as said, this is a very individual thing, and in almost all of the cases, it is not necessary, and children stay in good spirits. Lisa asks, my grandson loves to taste foods by mouth, but it is very slow for him to eat an adequate amount. He can swallow well. Would he get help with the physical issues associated with eating in the program so it doesn't take him hours to eat? Yeah, of course. We also have kids who have problems to eat sufficient amounts, or whose feeding takes very long time. And especially our feeding therapists, Marion, Cassie, and Eva, work with those kids in order to help them to yeah, meet their nutritional needs orally. Um, is it true that the longer the tube is in use, it is more difficult to get rid of it? Yes, that's true. So tube dependency um, can develop pretty quickly. Some kids already get tube dependent after 1 or 2 weeks. But of course, the longer you have the tube, the harder it is to get rid of it. Some kids need it for a very long time due to medical reasons, of course, then it's also not impossible to get rid of it. But one always has to keep in mind that the child gets used to the tube feeding. And there was also a thing like psychological and mental tube dependency. I've written an article if you're interested in this, because this is we see often in kids over the age of, let's say, 2. So they basically identify with the tube. The tube is a part of their body. The tube is a part of their identity, and they have a very hard time to get rid of the tube or to get rid of the special way of feeding or the special way they are treated. And so it gets harder the longer the child is on the tube. We are always very happy if kids come below the age of 1. Of course, only if this is medically possible. But if so, for us, it's always great because the kids don't have any signs of mental tube dependence. And if they get rid of the tube, they forget it the next day. So, yeah, if possible, the earlier the better. Would you say 2 months was a long time on the tube for a 13-month-old? Um, it's compared to other kids we see and wean off the tubes who have been on the tube for 6, 7, 8, 9, 10 years, it's not so long. If you have the chance to wean your child after 2 months, there is a good chance that they succeed pretty fast and well. Do you think we can rid of the tube because she's already 2 years old? Of course. As said, we have kids up to the age of teenagers and even young adults who succeed in getting rid of the tube. This is what we do all day long and what is our profession. And so we also work with older children. Although 2 is not very old because this is about the mean age of the kids we see. Okay, any further questions? My son shows no interest in food at all. He actually hates it. Do you think this could change? Of course. Many children we treat, they're not, I mean, they do not only hate food, they are really aversive. So kids who just go in a room where food is, who will start gagging, throwing up, vomiting nonstop. So we are really used to very severe forms of oral aversion. And of course, our treatment is suitable for those kids. And we take care of that because in order to get interested in food, you have to be hungry on the one side, not starve, but be hungry. And on the other side, food has to be attractive, food has to be fun for a child. And they have to learn that food is not something bad or something causing them pain, which many children experience because they've had, for example, severe reflux, or they had a lot of invasive treatment as babies or children, like intubation and stuff. So they have to relearn that food is not an enemy, but a nice thing. And this is part of our program. So we don't support any kind of force feeding or anything, but we want the child to develop autonomy and to be happy to deal with food and to eventually taste and eat it. Jamie asked, as there is a waiting list to come in person, would you advise to wait for a space or do the online course as you can start quicker? What are the big differences? This very much depends on what you prefer. The online course is only online. It's an asynchronous communication with a team of 3 experts, as said, on a daily basis, including weekends and holidays. In the Eating School program, where you will see us on site for 2 weeks, you will have a lot of single group sessions, a lot of parents groups, parent-child groups, individual sessions, and so on. A lot of on-site therapy. We have play picnics 3 times a day at the Eating School, so really a lot. And you also profit from the exchange with other parents who share the same problems you have, because sometimes parents of kids with feeding tubes or with feeding and eating disorders feel very alone because they don't know other families who go through the same situation problems, and they don't feel understood by friends, family, or sometimes even doctors. So for these families, it is very beneficial to come to the Eating School in order to share their experience and to meet other people who go through the same. Besides that, of course, the hands-on approach is, for some people, it is what they prefer. Other families prefer to stay at home because many of our kids have been to hospital for a very long time, so they are very happy if they can just stay at home in their familiar environment, and of course then the net coaching is the better option. In fact, it is, when you do the assessment, you can only sign up for your preferred program, and then we will watch out if this is the program you're suitable for. In rare cases, it could be the result of the assessment that we say, okay, this child is suitable for our program, but it's not suitable for the Eating School, but only for the net coaching program. This is, for example, in kids who are immunocompromised. We cannot take them in our Eating Schools because it's way too dangerous for them to be in a large group of kids and adults, or children who are on continuous oxygen, because if they get a respiratory infection while they're at the Eating School, we don't want them to be ill and end up in intensive care. So for these kids, we always recommend the net coaching. As said, so the final decision is always made by our experts after the assessment. If my son has a sugar level problem, can he still come? Yeah, that very much depends. I would recommend to do the assessment, and then we will check out with you which precautions we have to take in order to keep him safe. This will be done by our pediatricians. So yeah, I would strongly recommend to do the assessment, and then we can find out whether your child is a good candidate for our program. Bonnie asks, my son is 5 months old and was continuously fed by NG tube for 5 weeks, then moved to continuous feeds with an NJ tube. We've been told he needs fundoplication because of reflux, but nobody has ever tested him feeding without a tube since 2 days old. We would rather a tube wean without the need for fundoplication. Have you come across this before? Yes, very, very, very often. So I've seen a lot of kids who suffer from reflux due to tube feeding. So I would say about 90% of all kids who come to us have been diagnosed with reflux. And I would say about 40 have an application, or at least recommended to get one. I fully agree with you that tube weaning should be the primary goal, because in almost all cases the reflux completely subsides when you feed orally. It cannot be, well, it's a fact that if you have an esophageal tube, um, it increases reflux, and also with a G tube. So yes, the goal would always be to try tube weaning before you go for a nascent fundoplication, if it is medically possible. And yes, we see that in very, very many cases that they're advised to do a fundoplication because they have severe reflux, but in many, many cases it gets way better when the child feeds orally. So maybe telling you something about the other online program we have besides the net coaching for tube feeding. We also have the Learn to Eat program for kids with other feeding issues, such as non-organic failure to thrive, infantile anorexia, picky eating, problems with dream feeding, or some kids only feed with distraction, for example, in front of TV or iPad, or kids who don't succeed in getting rid of breastfeeding, bottle feeding, or in the transition to solid food. So we also have the Learn to Eat program, which is always led by one of our feeding therapists, and includes 1 or 2 phone calls per week, video calls, and lasts for at least 3 months. So this is the second online only option we have besides the net coaching. For which kids are suitable for the telemedical programs? If you're talking diagnosis now, basically every underlying medical condition which is stable enough for a child to feed orally. Our main diagnostic groups are premature, children who are born premature. It's about, I think, 55% of the kids we treat have been born too early. Then we have a lot of children with cardiological problems, heart failure, heart diseases, heart malformations, kids with different genetic syndromes, also very rare ones, but also not so rare ones like kids with Down syndrome or CHARGE syndrome. Of course, kids with some malformations in the gastrointestinal region, such as kids with esophageal atresia, children reflux, kids with metabolic diseases, or kids who have lung diseases or neurological problems, many kids with cerebral palsy, and of course also kids with feeding disorders without any physical problems, kids with oncological diseases, so a very wide range of underlying medical diseases. What if a child has no safe swallow, who chokes a lot, have an overactive gagging reflex, and therefore will not eat and needs a tube? Well, a precondition for tube weaning is that the child has a safe swallow, which means that the child doesn't aspirate, at least on certain textures and consistencies. So a child is not necessarily, doesn't necessarily have to be able to swallow thin liquids, but of course it needs to be safe. It needs to have a safe swallow for at least honey consistency and so on. But from what you write, a kid who chokes a lot and has an overactive gagging reflex, this is something we see very, very often in kids, in tube-fed kids. So some already start gagging at the sight or at the smell of food. And also the gag reflex is very, very overactive in most of the kids. So even if you only touch their lips, they start vomiting. So this is not necessarily to do with the swallowing reflex or with the safe swallow. Safe swallow can be proven with certain examinations, and sometimes in some kids with certain diagnosis or problems, we ask you to do such an examination in advance. But with many kids, the swallowing problem is not a physical problem, but a side effect of the tube dependency. Okay, is there any difference between NG versus G-tubes in terms of ease of weaning in your experience? Yeah, this is also a very good question because I know that literature says it's better to switch to a G-tube earlier because for the kids it's easier to get rid of it or to eat and besides the G-tube feeding. In our experience, unfortunately, it's not like that. So kids are as dependent on NG tubes as on G tubes. Of course, if a child requires long-term tube feeding, a G-tube is the better option as it doesn't irritate the throat at all times, and there is no risk of pulling it out every other day. And yeah, maybe there is always the risk of placing it wrong. But from the weaning perspective, we have even evaluated this question, and we did not see a difference in the duration or outcome or anything between NG and G tubes. So kids get unfortunately dependent on both ones. But if a child requires long-term tube feeding, which means over several weeks, then of course a G tube is the better option. We also have kids with J tubes, so jejunal tubes. So kids who are directly fed into their jejunum and bypass the whole stomach. So weaning is also possible from a jejunal tube as long as the swallow is safe and as the stomach is working properly. Can my child join net coaching when they receive feeding therapy already? Yes, of course, of course. The net coaching is really the tube weaning process, where the goal is to get the child to get rid of tube feeding. And if the child receives feeding therapy and likes to go there, of course this is fine. During the net coaching program, there's always the possibility for the therapists on site to join and to also exchange their experiences with us. So yeah, no problem. How long does the net coaching last? Yeah, I said until 35 days after the very last tube feed. For most kids, it very much depends how long it takes the kid to get completely off tube feeds. Some kids are really quick and are done within 2 weeks. Some need 4 months. So, but I think the mean duration is around 2 months. 2 months. But as said, very individual, very depending on the child and circumstances. Do I need to have a special program on my computer to do the net coaching? No. We have a special platform and you get access to it as soon as you have signed up for the net coaching. You do the assessment there, and after the assessment you get and the payment, you get access to your treatment platform. You only need internet, a normal internet browser on your computer, and for the videos you just need camera or your mobile, your cell phone, and you can upload the video directly from there. So you need a stable internet connection on a daily basis. You need a camera, maybe on your phone, on your iPad or laptop, for short videos of your child. And besides that, there are no specific technical requirements. What languages are you offering for net coaching? Also a good question. We offer the net coaching for German, English, and French. So these are the three languages we offer, in which we do the net coaching. If you speak another language, there is also the possibility that you bring an interpreter with you, and then we can do it also in any other language as soon as you have an interpreter for English, French, or German. What if you participate in a net coaching and after 2 months the tube has to come back because of too much weight loss? Does the coaching continue or get started again? But every family after the net coaching receives a final report from us, where it is also listed when they should get in contact with us again. So it would be good if you get in contact with us before too much weight loss happens. We write very clearly which weight loss is acceptable and in which case you should get back to us. And of course, then we will help you to get through this situation. Too many children come off the tube for a period of time before, but then stop eating again after time. Fortunately, not many. We have done a long-term study and have evaluated the feeding and eating and growth of the kids 1 to 6 years after completion of the program, and there were over 90% of all kids who were still without tubes. So fortunately, this doesn't happen very often. The children have to go back to tube feeding or stop eating again. That rarely ever happens. Sometimes, of course, when kids fall ill, they eat less and so on. And it may be frightening during the first month after the weaning, but of course, in this case, you can always get in contact with us and then we'll find a solution. Within 4 months after the net coaching, after the completion of the net coaching or after eating school, you can always opt for an aftercare ticket. This is a ticket you can book on a monthly basis. So if you decide maybe, okay, the tube is out for over a month and your child is doing well and the eating is going well, but you are under the impression, okay, I would feel more safe if I have 1 more month of daily contact with the team, then you can always sign up for the aftercare, and then the coaching continues for 1 more month. Then you can prolong it as long as you want. It's our aftercare ticket. What if I'm in a different time zone from Austria? How will we communicate? Yeah, we have a lot of patients and families who live far away from Austria, from the US, from South Africa, from Australia, from Asia. So of course there are many different time zones. This is why our communication happens asynchronous. So whenever you feel ready to enter the intake protocol, maybe in the evening, and to leave us a message with your questions and to upload the video, you do it, no matter how late it is in Austria. And if we do our rounds, which is mostly during the morning hours and late evening here in Austria, we will answer everything. So you always get an answer within 24 hours, mostly way faster. In your opinion, do hospitals give children a feeding tube too quickly and therefore create a problem of weaning? This is something that's very difficult to answer because there is a very large difference between countries. There are countries who place tubes way earlier than others. And there is also the problem that some professionals don't know about the phenomenon of tube dependency, so they think that tube may be a quick help, and then the child will eat again, and then we will take it out again after a month. So they are not aware that tube dependency is a thing, is an issue, and think that tube is the solution for a feeding or eating problem, which it mostly isn't. So it's very important to educate medical professionals on the topic of early feeding and eating disorders and tube dependency, but this is still a very long time, very long way to go. Do you take the tube out at the feeding school? That depends. If it's a nasogastric tube and the child is able to eat enough, we sometimes take it out during the eating school, and sometimes it stays in, and it will be taken out during the aftercare. That's very individual. The G tube we don't take out at the eating school because this has to be done by the surgeons on site. Exactly. How exactly does the contact take place during the net coaching? Are there also live sessions? During the net coaching, there are no live sessions, but the contact is done in written communication. In the special ticket area platform, where only you and the therapist can access everything. And also, I think some of my colleagues has his or her micro on. Okay. Yeah. So sorry. There are no live sessions, but there's written communication and with our team, and video analysis and intake protocol analysis, and so this is how it works. For the Learn to Eat program, there are also phone calls involved, video calls. Exactly. Our platform is secure, so it follows all the guidelines for medical data protection. And if we log in as therapists, we have all the medical information of your child at one site. So it's like a medical data file, and then we can answer your questions at any time. And of course, also comment on your child's intake protocol, on the videos, on your daily report. Which are the next options? What happens if the net coaching is not successful? Yeah, as said, one of the options is to come to an eating school where you can receive on-site support, hands-on approach. For some kids, they need it because we find out during the net coaching that you and the child need some hands-on support. And if it doesn't work at all, we have to reevaluate, but fortunately, this doesn't happen very often. Just checking the time, we're 2 minutes. We have still 2 minutes left. So if you have any questions left, please feel free to post.
Sabine, there was a question from Michelle.
Yeah.
And she was asking, how do you monitor the medical status of children when winning by net coaching, like electrolyte balance?
Yeah, exactly. I think I answered this question before. So we take care, we communicate with the families every single day, so including holidays and weekends. So we always plan the feeding for the next day, and then we see how the child does, and we never like reduce the tube feeding so much that the child gets a problem with hydration or electrolytes. So this is based on years of experience of um, education, and in every weaning there is a pediatrician involved who looks through the child's file every single day. So in order not to um, so in order to keep the child safe and stable, and all the parents get a, a plan for us what they can do in the case of emergency or before emergency, when the child is very low in energy or just not feeling too well, then we always have then they always have a plan from us. But I think the most important thing is the medical supervision on a daily basis, so one can really check on the child every single day and be in contact with the family every single day, ask for photos, ask for videos if we're unsure, and so on. Mirjana writes, our daughter of 1.5 years, who is a J-tube, has 3 specialists in our doctor's team for her different health issues. Do they have to give permission for the tube weaning? Do you contact them when the child's issues are very complex? Or is the decision if the child is qualified for the program based on the mentioned assessment? Yeah, the decision is based on the assessment, but this assessment includes medical reports of all your doctors of all professions, in your case, heart, lung, and digestion. They don't necessarily have to agree all to the weaning, because some of them you don't see so often, or they are not so interested in the nutritional topic, and they say ask the gastro or something like that. But of course, we need the underlying medical information, and we, in very complex kids, as you write, we also contact the either contact the doctors ourselves or ask the family to get in contact with the doctor, and we want additional information on this or that. So of course this also happens. So it is very crucial and important to have all medical professionals on board who are interested in this topic and who want the child, think that the child can learn to eat. And we have a lot of complex kids, so many of our kids have like 3, 4, 5 different disciplines of pediatricians. But in most cases, the gastroenterologists are those who are taking care of the feeding, eating issue. Okay. Okay, I can't see any more open question. Well, except one, how long is weight loss acceptable? This is a very individual question. This very much depends on very many different factors, like the age of the child, the underlying medical disease, the pre-existing oral skills, the growth status. So this is very individual and is decided for every child in every single case by our team and discussed with the parents. Somebody's asking, how many children do you have on net coaching on a day-to-day basis? Just wondering about staff numbers. I think we have about 70 or 80 children in our telemedical programs, and we are a team of 3 pediatricians, 2 feeding therapists, 2 psychologists. Yeah, we're working a lot, but this is also our passion, so yeah, that's what we love to do. So we're happy to help as many kids as we can. Okay, I think, Yes, it's already past 9. So thank you all very much for participating in this Q&A session. If you have any questions left, please feel free to contact my colleagues. They will leave you the email address in the chat section, in the Q&A section, so you can contact us and one of our team members anytime, whenever you want. They are also ready for a free evaluation, which is a phone call with one of our team members where you can discuss the individual situation of your child and get to know the individual options for your child. So please feel free to sign up. We will put the link also in the chat, and you will also receive an email after the webinar with the link to the record. So this session has been recorded, so you can rewatch it if you want or show to somebody else. Thank you very much for all your questions. I hope they have been answered as good as possible, and I wish you all a nice evening and good night.